Good morning. My name is Ogechi Plariwahu with learner ID 3681485. I'm making a presentation on the 19th unit on health promotion. This morning we are going to be looking at the models of health promotion, a summary of current health promotions, current models of health promotion. Biomedical model is characterized by the belief in health being the absence of disease. The model places an emphasis in the use of medical treatments to restore health in an individual. The behavioral change model, as the name suggests, seeks to make people adopt positive health behaviors such as the cessation of smoking or the increase of physical activity. In the socioeconomic model, health is promoted by the betterment of social conditions in a community or an individual. This can include efforts towards the increase in availability of social houses or the improvement of educational and employment opportunities for those that need it and wants to work. The ecological model is one that concerns itself with the several levels that interacts with individuals or individuals' life. Promotion of health at these different levels could include individuals as well as the population at large. Empowerment model allows individuals and communities to have greater control over their lives and decisions they make which can impact their health. Let's compare at least two models used in health promotion. Looking at behavioral change model, it is an individual approach to health promotion. It has been used, for instance, public campaigns to smoke in public campaigns for individuals who want to cease smoking, while also being seen on the one-to-one basis, like interventions to people with diabetes. These models' main aim is to influence an individual to take control of their health by the adoption of healthy lifestyles and making the necessary behavioral changes. On the other hand, the socioeconomic model, as the name suggests, focuses on an improvement in the social amenities or conditions of an individual in a community. This could be, for instance, by the provision of social housing, as well as improving educational and employment opportunities for those that want to work and in need of it. The most significant difference between these two models is the fact that the formers focus on the individual factors, while the latter is on social and environmental factors. I believe that although both models are effective on their own, the latter has a far more lasting and wide-reaching effect. An evaluation of the effectiveness of these models in promoting good health. Behavior change model of health promotion is effective in short-term basis. This is because generally it involves the use of public health campaigns such as smoking cessation, as well as one-to-one interventions like those used for diabetes. However, the model's effectiveness is reduced when you take into account the fact that a lot of times in deprived communities, the choice is not there. The socioeconomic model is far more effective because on the long run, it affects the greater part of the community in the positive direction. This is because it is a model that is able to reduce health inequality by dealing with a lot of the root causes. This could be in the form of poverty or educational inequalities. We can see that in the long term, the government is able to see a reduction in healthcare costs as a result of this investment in social determinants. The model is not without its drawbacks and setbacks. For example, it needs a massive investment in funding. It also needs several government sectors to be on the same page. A lot of the time in the real world, a combination of this approach of these two models, for example, if you target behavioral change, but it will also address some of the environmental factors that would have been otherwise prevented the behavioral change. Those are my references. Now we are going to give an explanation of the aims and objectives of a particular health promotion initiative. The Change for Life campaign was introduced by the Public Health of England to tackle the increasing obesity, which is related to the effect on both children and adults in the UK. The aims and objectives were to get people to make small yet achievable changes to their lifestyle by making informed and better lifestyle choices with regards to diet, daily exercises, and their alcohol intake. The focus is primarily on families with young children and making improvements and healthier choices such as healthy food alternatives and being more physically active. Objectives were set to increase public awareness and recognition of health risks and long-term effects caused by poor diets and levels of physical activities, to support healthier food choices in schools and at home, to decrease the rising number of children in the UK who are obese. Collaboration and partnership with schools, retailers and local authorities to make the campaign more relevant, relatably and realistic. Providing practical advice to families such as recipe cards, recipe cards, and family challenges by making the materials accessible and fun in the range of formats, including print and online. Change for Life aims to create a culture of health that supports long-term well-being. This is an evaluation of the effectiveness of this initiative in promoting good health. An instance of a program for the promotion of health succeeding is Health Change for Life with Evidence Points. The campaign has been efficacious in heightening the public's awareness of health hazards tied to obesity. Achieving such an outcome requires a good strategy that was thoroughly multi-channeled, consisting of television and advertisement, online resources, school programs to have a wide reach out. Furthermore, it appears that resources of Change for Life were influencing the food choices of parents. Those made aware of Change for Life were in the next instance more likely to have healthier choices and exhibit knowledge about living healthier as a matter of routine. However, the long-term impact of Change for Life has been mixed in terms of effectiveness. While there has been some evidence of short-term behavioral change, there is less evidence of sustained lifestyle factor improvement, particularly on low-income earners. Why is this? Food security, lack of access to program-tailored opportunities for physical activities, and individual reliance on willpower are some of the speculated reasons. Others say the campaign just doesn't hit hard enough. Despite these criticisms and its low impact on certain communities, Change for Life has raised awareness of the issue and equipped families with decision-making tools. This is an evaluation of the contribution of the agency or organization I have selected that makes improving public health. The health and well-being of the English population was served by Public Health England, later replaced by UK Health Security Agency and the Office of the Health Improvement and Disparities. Public Health England improved the health of the population and reduced health inequalities, that is, the unfair and unavoidable and the avoidable differences in health between different groups of people, which have a serious and damaging effect on the life of one group compared to another. Using a variety of science-based methods, this included providing health and policy advice known as guidance by the Public Health England, undertaking scientific and policy-relevant research that impact on a large proportion of the population, planning, promoting, delivering public health campaigns, and acting as lead conductor and orchestrator of the response to public health emergencies. The Public Health England took one of the most visible and impactful roles during the emergencies, leading the Public Health Emergency Response Team. This included the comprehensive public health work it undertook during the COVID-19 pandemic, where it has a most notable presence in data collection and dissemination of information, providing testing support, infrastructure, guiding the NHS through a set of newly minted protocols, and coordinating a set of infection control measures. In many ways, its public health presence during the pandemic was felt far and wide and in many places. both in the literal and metaphorical sense. Public Health England managed numerous large-scale preventative health programs. This spanned not just this spanned not just public awareness but also direct actions involving individuals. On the path to freedom from health risks, these programs aimed at achieving clear outcomes. Campaigns like Tobacco, directed at helping people give up smoking and change for life, aimed at reducing obesity, served not just to flag up health risks but to set in motion a series of practical measures people could take to throw off those risks. The Public Health Agency was also in charge of encouraging physical activity, again with practical, actionable and steps in mind. Moreover, Public Health England had the duty of carrying out and making available a broad range of health monitoring and research reports that were critical to informing local authorities and health service providers of the specific needs of their population. They were responsible for producing a range of invaluable reports that really helped identify the specific health priorities that warranted attention and funding at the local level. To lessen health inequalities, the Public Health England worked with local authorities, community groups, and other interested parties to tackle disparities with a sharp focus on the most deprived communities. It pushed for a way of working that was upstream or in the prevention camp, and that was focused on the wider determinants of health like housing, education, and work. To conclude, the Public Health England landscape and related policy have received a major beneficial and lasting influence from how Public Health England combined emergency response, health promotion, research, collaboration in its integrated approach. Its successor organization continued to build on this work already established. These are my references, and I'm happy to say that this is my last presentation on this course. I wish you a very lovely day. Thank you.